Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television. As usual, we're reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Recall that in the previous 3 weeks, we've started a conversation around the rights of the patients. We did 3 episodes on that, and I believe by now, so many of you that have been following the program would have had better understanding of the rights of patients, the meaning of medical negligence, and also what to do in any case where your rights have been violated. Today we are going to talk on the other side, the patient's responsibilities and the rights of the healthcare providers. Yes, a lot of persons don't usually like to hear about that aspect, but healthcare workers too, they have rights. We're going to be having a lawyer again. We've had 2 lawyers in the past 3 weeks. Another lawyer is coming to talk about the rights of healthcare providers and, of course, responsibilities, because for every right, there's a responsibility that must go with it. So a head of legal department at the Alex Ekweme Federal University Teaching Hospital in Abakaliki, Ebonyi State will be joining us. You'll get to see her shortly after this break. Do stay with us. We'll be right back. Welcome back to Talking with Dr. Laz, your favorite health program on television. Joining me to discuss the rights of patients, the responsibilities of patients, and the rights of healthcare providers, she's already there, is Joyce Nena Eseni. She's a lawyer and the head of legal unit at the Alex Ekweme Federal University Teaching Hospital in Abakaliki. Thanks for joining me on the program.
Thank you very much, Dr.
Yes.
Laz.
So we are going to be talking an aspect that you are very much involved in almost on your daily activities, ensuring that healthcare providers, their rights are respected, and also patients also their responsibilities are kept. So
Okay.
let's get to discuss this. We talked about patients' rights extensively in the last 3 weeks. They have responsibilities too. So could you take us through some of these responsibilities? And I can see the number of laws in your presentation that you listed out. So let's take it up from the first slide.
Okay. For every right of the patient, there is a corresponding responsibility that the patient owes the health worker or the healthcare provider. So we have the responsibility to provide and care for relevant information. The patient is expected to provide details about any changes that occur during or while having the treatment. The patient is expected to understand the treatment plan. The patient also has the responsibility to request for information. Yes, we know that the patient has the right to relevant information. It's also the patient's responsibility to request for information. We expect that, yes, we expect that the patient does it courteously.
Yes, Mr. Seni, right. I'm going to take you further on that so that we could get some relevant details. So, but I can see from what you shared with me that these responsibilities of patients derived from the 1999 Constitution as amended, National Health Act 2014, Patients' Bill of Rights, Medical and Professional Code of Ethics, Geneva Conventions, and some international treaties. That's where these rights of healthcare workers as well as responsibilities of patients lie. So you've talked about providing factual information with relevant details. What could be a potential consequence when a patient fails to provide factual information?
Of course, where the patient does not disclose relevant information or factual information and it affects his treatment, the healthcare worker wouldn't be liable in that regard.
Okay, so preserve health records in his or her possession. So what are
Yes.
examples of those health records that can be in the possession of the patient?
There are some med lab investigation or diagnostic investigations that come before or any treatment. So sometimes, depends on the health facility, the patient may be asked to go with that because he's his records. So we are asked to, the law expects that the patient should protect such records. If you have any extra film with you, and you know that your subsequent visit is going to be connected with such diagnostic reports, we expect that you protect it. And when going to the hospital, because it may not even be the hospital you visited last that you visit again. So when
Yes.
going to the hospital, we expect that you get all the relevant documents, the film, the report, the results, and you see your doctor. You tell the doctor, these are the documents or the lab results I had from my previous visits, and it will help them with informed, decision
Okay.
and know the next step to take depending on how far or how soon the investigations were conducted.
Okay, so that may also include like X-ray films, that are given
Yeah.
to, or even
Yes.
CT scan results
Yeah.
that might be given to
Yes, sir.
patients. So, and including hospital card as well, right?
That's very important because with the card, you'll be able to access your hospital folder.
Okay, so there's also a responsibility to request information from healthcare providers on treatment decisions. Some sections of the National Health Act says that a patient can ask any question and must get an answer. So here is also a responsibility for the patient to ask questions.
Nicely, as long as the patient is nice in his approach, I believe that any healthcare worker you ask questions about your treatment will oblige you. They'll give you the right answers.
Yes, but there are some that don't actually, and I've actually seen that, especially at
Even
the
when
primary healthcare level.
even when the patient is not nice in his approach, or when the patient is nice
Yeah,
in
yeah,
his approach,
yes, yes. There are some that just asking questions. They'll be like, "Are you teaching me my job?" It happens. Maybe not common at the level of the hospital where you work, but when we are talking
yes,
hospitals now, we are not just talking about teaching hospitals. We are
of
talking
course,
about
of course.
healthcare facilities
Health centers,
from
clinics,
everywhere,
yeah,
even pharmacy stores and all that.
yeah,
So
yeah.
there is also this provision: treat all hospital staff with respect and dignity. Can you speak more to that?
Yeah, the law on the side of the patient expects that the healthcare worker will treat the patient nicely with respect and dignity. Also, the patient has that responsibility to also treat the healthcare worker with respect and dignity, no matter how they look. It doesn't matter the origin, their race, their complexion, or anybody, disability. The person may not have the right, maybe one maybe visually impaired, one somehow. So but you expect that it doesn't matter how the doctor or the med lab scientist look, as long as the person is attending to you, is human. So first of all, we expect that you treat that person nicely with respect and dignity.
Okay. So things like there are some patients that maybe because of their economic level or their influence in the society, they might come to health facilities and want to order the health workers around. So is it an example of not treating with respect and dignity?
Yes, but I want to believe that such patients misunderstand or misinterpret their right to choice of healthcare worker. Yes, you have a choice. You have the right to choose who you want, but as long as you're making such opinion or request nicely, you understand if that such is with respect and dignity. If you nicely tell me, please, I would like to be attended to by someone else, I will oblige.
Okay. So there are further responsibilities. Be punctual at clinics and hospitals.
Yes, yes, you don't presume or assume that the hospital is one that would always be there, always run. The clinics will always run from 8 to 4 p.m. If you have an appointment with your doctor on a particular day at a particular time, it's your responsibility to make sure you meet up with such appointment at the right time.
Okay. So what about ensure reasonable visitation? What does reasonable visitation mean?
The hospital or facility does not just care for one patient. It's kind of a public place. It doesn't matter if it's a private hospital. So just the way you have rights to visitation, other persons admitted in the hospital also have such rights. So where you want to exercise such rights, you have all the hospital or the healthcare worker that responsibility not to abuse your right to visitation. Comply with the hospital policy. Sometimes they could say visiting hours 4 to 6, and maybe not more than 4 persons. We try to respect that. And that's all about.
Yes, I know that in hospitals sometimes you can actually have a lot of challenges trying to control patients' relatives who have come to check on their loved ones. So sometimes the security folks in the hospitals usually have challenges dealing with that. So this is just telling persons, okay, if they say this is the time and this is the number of persons, in as much as you know that you love your patients, but try to respect that. Okay, so make complaints to appropriate authorities. Who are the appropriate authorities?
There are 3 levels. The hospital where you're being treated have your rooms, mechanism for redress.
Okay.
In federal government hospitals, you have an office called Servicom that attend to issues like that. So you don't just have issues with the hospital or the healthcare worker and you go outside to the police or a lawyer outside. No.
But sometimes patients have issues that they don't get the kind of response, satisfactory response from the Servicom unit. Some are not even aware in the first place that there is a unit within the hospital that they can make complaints to. So how should the hospital make patients know, every patient that comes, that if you have a complaint, this is where to channel it to?
Okay, at least we have this your talk show now is going to expose patients to this, Servicom. They're going to give them awareness on this now. Most hospitals have Servicom stickers and phone numbers for complaints at the doorpost of the clinics. They also have complaint boxes. Sometimes, if you can't reach them or you feel that the relevant authority, like the Servicom or other corporate communications PRO units cannot attend to you, as long as you nicely go to a higher authority within the same facility, they will listen to you and make sure that your problems are resolved.
Okay, so I'll quickly go through the remaining responsibilities of patients, and we'll take a break and come to talk about the rights of healthcare workers. So adherence to prescriptions and treatments plan. So I think that's straightforward. There is one I would like you to speak more to. Decline medical care if not convinced of the quality. And you say this is not applicable to minors less than 18 years. So in which situations can a patient have a responsibility to say, no, I don't want to continue with this treatment?
Where informed consent has been sought and obtained, it is the duty of the healthcare provider to make sure that they explain the pre-treatment plan. They let you know that you have the right to decline. They also let you know the consequences that follow up your declination. So once all these are complete, they have processes for that. They have conditions for that. Once they are well played, then the patient can say, "Oh, sorry, I don't want to continue with this plan, or I want to oppose to this particular medication or procedure." But the patient must be well informed. Yeah.
Okay. So does that also include living against medical advice?
Yes. Discharge against medical advice.
Or discharge against medical advice.
Yes, DAMA, yes.
Okay,
yes,
so that is in a situation where a patient, maybe they feel they have an alternate place where they can get better care and they want to discharge themselves. But in that situation, the healthcare provider must counsel the patient on the implications, right?
Yes. And most times they go, when they leave, they come back in a worse state. The law says when they come back, even in the worst state, the law says that the healthcare worker must admit that person, must treat that patient. It doesn't matter if the patient earlier, signed discharge against medical advice. As long as they are back,
there was actually a case I was involved in managing, an orthopedics case where the patient discharged against medical advice and came back with gangrene and, in a terrible state. So the hospital rule was like, okay, it requires the director of medical services, the CMAC, the
Okay.
director of clinical services to approve the readmission. So you are saying that, yes, should a doctor on duty just admit, or it has to go through some protocols before readmitting the patient?
If the patient has been in the hospital before, such records must have been documented in the folder. So you admit, and you must make sure you document. Documentation is very key. The law says
Okay.
you readmit.
So it's not right to put a condition that the director of clinical services must approve for the patient to be readmitted, right?
No.
Okay.
Such policies will be reviewed.
Yes. Okay. So for those hospitals that still do that, I think it's something they need to review. So the final patient responsibility is seek suitable alternatives for the continuation of medical care during interruption of treatment. So, for instance, the commonest cause of interruption of treatment in a lot of public hospitals in Nigeria is strike action. So what should the patients do in that situation?
The doctor or whoever is attending to the patient must have given the patient options. In a way, you could say the doctor's duty to refer. So you could say, please, we're going to, because of this challenge or this frustration, we're going to refer you to this other facility for further care.
Okay. So thank you very much, Mrs. Eseni. We are going to take a break. When we return, we'll continue the conversation. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Before we went on a break, I've been discussing the responsibilities of patients and the rights of medical workers or healthcare providers in Nigeria. So we'll spend the rest of the time talking about the rights of healthcare providers in Nigeria. So good to be back to you, Barrister Joyce Nena Eseni. We'll quickly run through this. We have less than 10 minutes to do this. So the rights of healthcare providers. So there's rights to exclusive professional practice. What is that about?
Yeah. It's the right to practice what you've been called for. Once, for example, a doctor has passed his medical exam and the board, he has taken his oath of office and he has renewed his license for the year, the law says that you have the license or the right to practice that which you have been called for. Just like a lawyer who has been called to the bar.
Okay. So what about some health workers who go beyond what they've been called for?
Wow, that is what I call deviation. Once you deviate from the standard protocol or practice, that's a red flag. I wouldn't advise anybody to do that.
Okay.
Stay within your protocol, your professional, duties.
So healthcare providers also have right against injury or damage to person and property. This is one aspect, one right of health workers that is usually violated in a number of our healthcare facilities. Do you have any experience in your healthcare facility where such had happened?
No. I would say I give it to the management of the hospital where I work. We make sure that everything is put in place to minimize such injury or damage to person or property.
So there's not been any case where a patient relative assaulted a health worker in your hospital?
Okay, that one has to do with the the health workers' right to refuse. There have been times where patients get, aggrieved and provoked, and they try to assault or batter, the medical worker. Yes, there have been times like that, but we have, procedures, mechanism for redress. And I always tell them that you just make sure you report to the appropriate authority. If there's been trauma, make sure you see the hospital doctor on duty. You get a folder, make sure it's documented, you're examined, it's on record. Okay? The hospital authority know how to go through, complaints with the Nigerian police force or every other law enforcement agency.
Okay, so in a situation where a health worker's rights on this has been violated, a health worker has been assaulted, do you have the right to withdraw your services from treating the patient? Does the health worker have such right?
Yes, the law says, the National Health Act says that the health worker or the provider has the right to refuse treating the patient who physically or verbally abuses the staff,
Okay.
or who sexually harasses him or her. So, but there's exception to that. That exception is for psychiatric patients.
Okay. Okay, that's fine. So we'll run very fast now. So there is right against disease transmission. So what that means, the patient should adhere to all protocols and ensure that it doesn't transmit whatever this, and even full disclosure of their health
Yes.
condition so that they don't transmit infectious disease to the health worker. I know your hospital have some experience of Lassa fever from patients to a number of health workers that have lost their lives. So in that situation, what does the hospital do?
I have to take us back to what happened some time ago in Patrick Sawyer's case.
Okay,
You know?
so Patrick Sawyer's case is a very good case a lot of us know about. If you begin that, we'll spend the rest of our time. Sorry about that interruption, but let me move to the next. Right to consensuous exemption. What does that
Yes.
mean?
The law understands that for some reasons, maybe your personal belief or religious belief, you don't want to participate in some procedures, in as much
Okay.
as such procedures will be lawful. For example, maybe because I am not, inclined, or my belief is against blood transfusion, the law permits me to exempt myself. But the condition is, except there's another medical worker who can take up such schedule or duty. Where there is none, or where there's a conflict between yes, you must always resolve such conflicts in favor of the patient.
Okay, so what that means for some from, there are some from religious organizations that don't believe in blood transfusion. So if you are one of such, you must make sure that a healthcare provider, a doctor that can do the blood transfusion is there. So if you're a health worker and don't believe in that, get an alternative. If you don't and a patient dies, you are culpable.
Yeah.
That's what it means. Okay,
Yes.
so we'll quickly run through the rest. Right to professional indemnity is a legal term. What does indemnity mean?
It's about insurance policy. It helps you in times of litigation and damages or judgments, So it helps the hospital and even the doctor or the healthcare worker to minimize that burden of paying hospital court judgments and damages.
Okay,
yes.
so some kind of protection for the health worker. So right to refuse to treat, I think you've talked about that and the situation where such could arise, except if the patient is a known to have psychiatric disorder, but in other situation, right against discrimination. So on no account should a healthcare provider be discriminated against, irrespective of race, gender, complexion, disability, origin, or any other ground. So right to protect child's rights. This is an interesting case. I once had a patient that needed blood transfusion. They had severe anemia, anemic heart failure. So, and the dad didn't accept that right. So a healthcare provider can enforce that right if the child is a minor.
Yes,
okay,
there are procedures to that.
Yeah, so your final words to the health workers in this case.
Final words, I would always tell you that you should see every patient as a potential lawsuit, because most times the patient you're most benevolent to is the one who's likely to sue you, or whose relatives are likely to sue you. And documentation is very key. What's not documented never happened. Where you have your documentation in a chronological manner, your chances of having an acquittal in a case of negligence, is kind of high. As long as you and you don't deviate from standard practice.
So thank you very much for those final words. Thank you, Barrister Eseni, for joining us on the program today.
Thank you, sir. My pleasure.
You're welcome. And to you, our viewers, thank you for joining us today. Please, let's keep the conversation going through our various social media platforms displayed on your screen. Thanks, and see you same station, same time next week. My name is Dr. Laz Eze. Bye for now.